Today we're going to talk about enhancing digital patient experience with React Native. I'm Gregg, Senior Developer at Phase 2 Technology.
I'm Chris Glenn, Product Manager with Northwell Health. All right. So about Northwell Health, for any of you that are not from New York, if you're from New York, I'm sure you're familiar with us. We are the largest private employer in the New York City area. We're also the largest healthcare system in New York. We own 23 hospitals, more than 700 outpatient facilities, medical school, research institute, 68,000 plus employees. We're huge. So for anybody in New York, we own the Healthplex in Greenwich Village, as well as Lenox Hill, Long Island, and Queens are where most of our footprint are. And we also own a couple of hospitals in Westchester, and we have strategic alliances with companies all over the country. Our service area serves more than 11 million people, and we treat more than 2.5 million of them annually. So we're big.
So, Phase 2 Technology, we are a digital experience agency built with open technology. So we serve healthcare, government, sports, entertainment, media, so a little bit of everything. And we are hiring for anybody who's looking.
We are too. All right, so what is DPX? So DPX is just our shorthand for it, but it's a digital patient experience transformation team. And what we are is an interdisciplinary team. We pull people from all over our healthcare system. So we have a talent pool of 68,000 plus employees. We pick the best and the brightest from a bunch of different areas. And we also partnered with Phase 2 Technology to help us with some of the areas where we did not have competency that we needed, right? A lot of it is on the digital transformation piece. So what we are doing is we are building app and web apps that transform the way we interact with our patient population and create a bit more of a modern experience for our patients. All right. So one of the issues that arises, especially with a company like Northwell, where we've grown mostly through acquisition. We went from a small, 8 hospital system up through 23. As you grow through acquisition, you end up with a lot of disparate systems. And these systems don't necessarily speak to each other. And this can create a fragmented or disjointed patient experience. So you can walk into one of our medical practices at one location, have an excellent experience. You walk in next door, it's got the same Northwell logo, and we ask you the same questions. We make you fill out the same paperwork. We do the same thing over and over and over again. And so this is something we want to address, and so we want to bring this information together and create some more institutional knowledge about our patients. All right, so what we want to do is bring together all of those different containers: scheduling, finance, patient access, clinical systems, fundraising, marketing, everything, and bring it into one system where we can actually react to that information in real time. All right, so a little cartoon we found. So I like this one. And your friends will be able to follow your colonoscopy on Facebook. So one of the things we looked at is how do we start building digital patient experiences around what people want, not just what we're capable of, which is something that we found ourselves stuck in year after year. Is we want to do this, but we can't because this system doesn't do this, or this system uses this language, or this system doesn't have APIs. So we wanted to take a step back and look at what do patients actually want, what do patients actually need, and then we'll figure out how to get it done. So we listened to more than 2,000 hours of patient interviews, patients and staff, and we found out they all want the same thing. They just want us to nail the basics. They want very simple things. I mean, and nothing is simple in healthcare, but things that sound simple, that make their lives a little bit easier and make our transactions a little bit more seamless. Right? So which of these patient issues are we addressing first? The first one is you never remember who I am. So like I said, with all of these disjointed or fragmented data systems, we don't remember basic information about our patients. Right? I can't get a new patient appointment for over a month. Everybody in this room has had that happen. Somebody refers you to an awesome specialist, you go look for the next appointment, and they're like, yeah, we'll see you in 91 days. Or actually, I found one person in our system, it was 237 days for the next appointment. All right, what do I do now? I've just seen a doctor. I've been referred somewhere else. I owe money. I have no idea what comes next. Right? My bills are confusing, and the payment process is stressful. So this is another one where we grew through acquisition. If you received 5 bills from us in the mail, they all had 5 balances. None of them had one comprehensive balance. If you wanted to pay your bill, you had to log in with the invoice number, execute the transaction, back out, log in with the next one, execute the next transaction, etc. So we want to create one bill pay experience that makes it a lot easier for you to give us money. All right. Which app should I use? How many accounts do I need? What do I do? So that was one of the things we looked at. It happens with a lot of healthcare systems. There's a lot of white labeling and passing between systems, but there's not always good single sign-on. So you have 8 different accounts for 8 different systems. You don't know which one does what. So what features are up first? So this is what we consider our MVP. All right, first one, this is my world. I'm the product manager for Access to Care. So we are building the ability to book your own appointments online in real time. Right? The ability to request appointments for physicians that we have not yet turned on for appointment requests, or book online functionality. The ability to see your visit history. So what have I done with Northwell? What do I have next? What are my past appointments? What are my upcoming appointments? Future state, if you want to request a medical record for one of those visits, we'll integrate into that system as well. And then also the ability to change or cancel your appointments online. Every healthcare system struggles with no-shows. People book an appointment, they just don't show up, and that's operationally, that poses a lot of challenges, right? It's bad for patients because they end up waiting in the waiting room for longer because doctors decide to overbook knowing they're going to get some no-shows. So what we want to do is make it easy to change or cancel your appointments online so that things stay realistic. So you don't have to no-show, you can actually cancel your appointment or reschedule it to a date or time that's more convenient for you. Registration, Biometric Id. We recently rolled out deep facial recognition and iris capture software to 60 of our physician practices. So when you show up at the front desk, we know exactly who you are because it's a unique signature. And we can cut down on duplicate patient record creation and also insurance fraud. Right? Digital forms. When you schedule an appointment, you go to the doctor's office, they hand you a clipboard with like 60 pieces of paper on it. My example before, you might have just filled that out at the office next door, same company. So digital forms, what we're doing is you're going to schedule an appointment in our app. You're going to get a text message that says, hey, we need a little bit more information about you before we get started. How about you fill it out right now while you sit on your couch before you even get to our practice? It'll integrate back into our systems and the data will be stored in the appropriate places. Support. As a healthcare system and not a technology company, we've never really had patient-facing support, right? We have help desk for our employees, but who do patients call when they need help? They call a billing office, and that's really it, or you call a doctor's office. So we stood up our own dedicated support team that can handle both the patient-facing and the employee-facing issues. Right? We've also built dedicated help and FAQ channels on the app. We're also looking at some chat functionality, chat bots, etc. Financial health, I covered this one briefly. So instead of having to log in and pay 14 different bills with 14 different transactions, we created one bill pay system. We connected all of our treasury systems across the enterprise. So you log in once, you're going to see all your bills. You can pay it all with one single transaction or set up a budget plan, save your card on file. Moving forward, we'd like to integrate with Apple Pay, Android Pay, things like that to make things easier for you. Platform. Obviously, for all of this to work, we need to build a robust platform, not only one that we can build our things on, but also that we can connect to different apps and features and functions throughout our healthcare system. Once again, 68,000 employees. We're not the only ones building apps. We do have an incubator program in our company as well, so we want to be able to offer the platform to support additional functionality. And then finally, identity. We want to remember everything we can about you so that you never have to tell us twice. So we set up a Northwell account, your patient profile, and we also offer integration into Follow My Health, which is our EMR. It's not a Northwell product, it's an Allscripts product, but we offer direct integration in there, and we would like to enhance that going down the road with some deep linking, so you can go right into your lab results or your notes from your physician.
EMR is electronic medical records for people who don't know the acronym.
I speak in acronyms. Electronic medical record. Right.
All right, so now we're going to talk about how we actually built this thing. So Dpx architecture, this is a very high-level version of it, but it's enough to get you started. So basically, right now we have the app and the website connect to a bunch of APIs. We treat those APIs as just a black box. So we have scheduling, authentication, HIE, which is the Health Information Exchange, which is a general term for anything that basically gathers data and brings it together in an EMR. The insurance API and a billing API. All of these are external systems or systems that we're integrating with that we just basically treat them as a black box. As a developer, we don't care what they do. They all come in and we integrate them into a node Node.js server. And this Node.js server handles all of our processing of the data. So it integrates them, allows us to put in a format that we can understand, because some of them are SOAP, some of them are REST, some of them are GraphQL. And then our app server gives us REST and GraphQL endpoints, depending on what we're doing. And it spits it out into a consumable endpoint. So we have one single endpoint that the app and the websites talk to, instead of going out and trying to talk to all these individual things themselves, because that's a logistical nightmare. Because a lot of these don't have public APIs, they have things that we can't touch. So that's how we just treat it as black box, or this thing we only know the app server. And then all this feeds directly into the mobile app. So the app is built with React Native. We chose React Native because we can rapidly prototype. So this was a proof of concept, 2 years ago? Right. 2 years ago, they built a mini prototype and it's like in React Native, because phase 2 has JavaScript expertise. So we're like, we know this, we can build a platform. Also, it's easier for us to find React Native and JavaScript developers, because we can just tap into our pool of existing developers. Even at Northwell, talking to them about trying to hire, that's why they chose React Native, because if they want to spin up a team and they're like, well, this team can work on both web and native and be able to get out everything together. Also, it's only one code base, so it's one nice thing is that instead of having 2 dedicated teams working at different velocities and having the app come out at different stages, like many apps that we see that have split off from their React Native, they're always going to be in sync. So, few of the hard things that we have to try navigation and routing. It is one of the hardest things that you have to do in React Native. There's a couple options. There's React Native navigation and there's React navigation. So React Native navigation uses native code. It comes from Wix. Yeah. It comes from Wix, and basically if you are touching anything where you have an already existing app in native and you're trying to add React Native into it, that's when you reach for this one. We chose React navigation because we were starting from scratch, so we had nothing to start with. It wasn't like we were trying to integrate with another app. We're building this from scratch in React Native. And it works really well. One thing that doesn't work so well is deep linking. It's kind of in progress on React navigation, but we're working to try to figure out how to get that to work, because we have a lot of options. When you create an account, you must go and verify your email. And that email goes off, and then you have this link, and the link takes you back to the website. Well, that's not great, because you signed up through the app. So they want you to, in the future, come through, click a link, and be like, oh, my phone knows that I have the Northwell app. I'm going to go and deep link right into the sign-in process. State management. So everybody knows React and state, right? Basically, there's 2 options. There's MobX and Redux, right? It's the 2 that work for React Native. When we started this years ago, MobX was not even an option. So we chose Redux. Our state is massive. Like our initial state is 400 plus lines of code. Because we keep everything. So your appointment history, all of the data from the provider, so when you search, it all comes through and goes into state, so we can save this stuff and cache things so that whenever you come in and you're coming back time after time, it ends up creating a better experience because it's so much faster, because we're not caching as much of that data as humanly possible. We have well over 100 actions throughout the app to spin up and kind of maintain everything that goes on in the app, because we have to change things between screens, and like all of the user profile information is saved that way. So as we've built this front end, so we've had this styling progression. We started out with native base, which is a pretty well-known library that basically gives you a bunch of starter components. Quickly we found out that the design started deviating far enough away from it that we decided that it was time to build something ourselves. So they built, Northwell UX designers went out and they built a design system just for the app. There was already one for the website that existed previously. There was nothing for the app. So we had to go through, and they went through, built all these components. There's well over 200 components. And we built the DSI in Figma, and then 2 days ago, or last 2 days, a team was at Northwell and we built the entire storybook out with the new design system, and then over the next release we will be implementing all of those into the existing app. So the app that you will see is not the new designs. There's a few new designs, but for the most part they're not. So this is a small snippet of our Figma app with 200 components. The UX designers at Northwell spent a ton of time, nitpicking every little detail, and we set up a bunch of standards because currently there were multiple people designing and nobody was talking to each other. So now we have one single language that any Northwell UX person can walk in and be like, I need to build a screen. Great. I have all of these atoms, tokens that I can grab and start building screens out. So then, Storybooks, we took a small screenshot like this was literally last night. It was the screenshot after, 26 hours of coding. So right now we did the hackathon, so we have knobs that allow us to change props, so you can see, so designers can go in and they can see it on their phone. We have an in-app experience. It's not available on the public app, but it's only available to the QA builds that we send out to designers and product owners. So you can go in, you can see everything you need, you can change the props so they know, hey, I can change this to blue or green. I also have notes in there so that we can write content of, hey, here's how you use this specific component. That part is not completely fleshed out because we just ran out of time. But now that it can be in their designer's hands, they can go in and be like, here's how we want to set the rules for this specific component. And then now I'm going to attempt to demo this so everybody can see.
Rick, do you want me to kill the light so it shows better?
We will see how it shows up.
Should we do it? Go for it.
Where don't you move?
It's number 3.
Oops.
Thanks. Ooh, that's not bad.
Where is it?
Moon waiting for you.
Oops, it won't move up. It won't go. All right. Here we go. All right. So far, so good. All right.
It works.
There we go. So, welcome screen. So we have a lot of features here. The first part is the display health notifications. So at the top of the screen, we have dynamic notifications that can be set not in the app. So there's a CMS that powers those. So all of those notifications, whether they're global notifications or patient notifications, this example was a global emergency notification, but there's also the ability to add bill pay notifications, upcoming appointment notifications, verification. So if you are not verified, this account is verified. If you're not verified as a person, it will ask you to verify. So as a person coming in, when you create your profile, we need to go through and make sure you are who you say you are. If you come in and say you're Britney Spears, anybody can come and say they're Britney Spears, but we need to make sure that you are actually Britney Spears. So we use Experian to go through and verify your identity. If we have time, I will demo that, or I'll attempt to demo that, because I've never done it in person. So yeah, it's very important for us to verify. So basically, if you're not verified, you really can't do much other than search for a provider. So we have ways to get into the app. So you can find doctors, you can find locations, you can look at your appointments, you can pay a bill. Those are the most important things that people want to do in the app. So we give them a place to do those right out of the box. And then we have the integration with Follow My Health. I don't have Follow My Health because this is not a real account, so the link will not work. But basically, it's single sign-on. You click in, it already signs you in. You're already one person. And then also, if you go the other direction, if you go from Follow My Health back into the Northwell, if you click something to see your appointment history, it'll send you back into the app. So there's a two-way binding with that. There's a lot of work done with SAML to get a lot of these integrations to work with third-party partners like payments and like Follow My Health and other electronic health records. So first thing we'll do is we're gonna go find a doctor. The ability to search by name, so we can search for a doctor that we know. Go through, shows her locations, shows all of her insurances that she accepts. We also have credentials, so it tells you all the information that you know. So if you don't have any idea about this doctor because somebody just told you about them. You can see if they are actually a real doctor and not somebody who got their medical degree on the internet. And then we have patient ratings. This is also a third-party system that we integrate with. That we pull this data into the app server. The app server then consumes it and spits it out into their profile.
Does that mean since you have the app and can the user enter, say, their current insurance, will the app be able to flag?
Yep. So if we go back, if I type in Aetna, I'll select a plan, I search for cardiology. And if I'm in Melville, so now this is going to give me results based on my location. So this gives me every doctor that is a cardiologist, that's cardiology listed in their profile, and then it also sorts them by distance.
This feels snappy. Are you making API requests?
Yeah. Yeah, there were multiple API requests currently. So when you do that search, it grabs the API for the search, comes back, returns it. But the API for the search is not just one system. It hits 2 different systems to get that.
Is that through the same single endpoint that you guys have set up?
Everything goes to the app server, but the app server has called 2 endpoints to get those results. So you can notice that some of these providers don't have a make an appointment button because they are not actually bookable. There's a thing of doctors that cannot be booked because they are hospitalists.
Hospitalists, radiologists, people that you don't book care with.
Yeah. And then if you hit a doctor that is not bookable, so like an experience that we cannot actually book them online because they're not turned on yet, you will get a form that you can fill out, request. This form goes to an agent. Agent says, hey, I'm going to call them back and I'm going to book their appointment for them. And it's fast. Like it's within 24 hours.
And the reason why we do this is we know that online booking is a challenge, so we have to scale at speed. In the meantime, this allows us to put a conversion point on every provider profile and make sure that you can book care with every bookable provider, even if we haven't enabled online booking yet.
Yeah. So I'm going to go back to a provider that I know I can book with. Which garbage is it? Joanne?
The first one.
No, she doesn't have multiple locations. Who has multiple locations?
William Joseph Bennett.
Yeah. If I can spell Joseph. So actually this type of head field is actually hitting an API as well to generate those results.
Yeah.
So as you go through, so if I search Bennett, like it comes through and it starts searching. It goes to the entire list of how many providers?
In Find-A-Doc, roughly 17,000.
17,000 providers that it's querying to go through and grab them. And also it's doing 2 queries because it searches both providers and specialties at the same time. So there's 2 different, so basically you give them the option to search by provider or by specialty.
What kind of caching are you guys doing for these kind of requests, these API requests?
So they're all cached on the node server.
Okay.
So as much of them as we can cache them on the node server. But that is actually hitting GraphQL. So that's a GraphQL endpoint that's hitting that. So this provider has multiple locations and multiple specialties that we can book for online. So you can go through, you have the option to self-pay, you don't see your insurance, you hit that button, it says, hey, either gives you the option to continue with self-pay, find a different provider. So it's very helpful to allow you to kind of go through and figure out, hey, if I got to the provider accidentally that doesn't take my insurance, it gives me options on what to do to kind of help their financial health as well. That's one thing that they've been trying to do is financial health, which is kind of a different perspective of normal healthcare. So I go through, pick my insurance. So now I have the option of either family medicine or geriatric medicine, of which specialty I'm going to provide. Option to say yes or no whether I've seen this provider. Operationally, it's a difference if you've seen the provider or not, but there's also rules around it of if you've seen the doctor within 3 years, you're not a new patient. But if it's after 3 years, then you're considered a new patient. So the appointment slots they show would be different. And then reason for visit. So this gives you a list of things that you can see the doctor for, right? So we're getting a patient appointment. So this is hitting how many? This is only hitting Find a Docs. That's only one API. It's the next screen where it hits the find times, which is going to multiple.
Find times there too.
Oh, it does hit find times there, yeah. So actually, let me go back because I kind of skipped through that. So on the locations, it gives you a peek to the next availability. So that's coming from the find times, so we can go through and see exactly when. So you can kind of pick whether it's distance. So since we didn't enter a distance in, it doesn't give me a distance from where you are. But if we had entered a distance in, it would it would sort these which is closest to you. If they're identical, which can happen very infrequently, but it can happen, it will show by first availability.
One
Are
thing
you
to note
managing
too.
this state of this form in Redux?
Yes, this is all saved in Redux currently.
The reason why we require location input at this point and not originally is because if I'm a provider, I can be credentialed to work in a number of different places. The way our scheduling system works is when you build out the templates, I can set, all right, Mondays at 8 o'clock I'm at this site, Tuesdays I'm at this site, and I can also put rules. I don't see these visit types at this site or this one. So if we have you pick up front, there's a solid chance we're going to dead end you. Like, oh, you picked new patient appointment at this site, we actually only offer that here. So we actually query the system first and say, hey, show me the next 1,000 available slots for this provider, and then we evaluate that for locations and present it there.
Wow, cool. So is that a limitation? That only the next 1,000? So if someone asks for like.
I mean, you're never going to get more than 1,000 in our real production.
We've never had we've never been oh, we tabbed out too many times.
Yeah.
Very rarely will that actually ever happen. And I think there's only a few doctors that have 40. What is it? Is it 60 slots a day?
It can be.
It can be up to 60 slots a day. There's very few times when they have all 60 slots available in a single day.
So talking about the UI a little bit here, how much of this would you say is still native base and
This is 100% custom.
custom?
This the date picker and time picker are 100% custom.
So, okay, you
Yes.
wrote the date stuff from scratch?
There's a library that generates the calendar,
yeah,
but it doesn't do anything else. But we actually are redoing this entire screen, and it's not going to be a date picker like this. It's going to be on one screen, much cleaner UI of not having to tab between two different things. The kind of limitation here is we go and do find times, and it returns both dates and times. So we have to parse what happens, right? So if you select a date, then we have to explode what the date, this list they give you in dates and times, and that's why we had it set up like this. But we're going to do it so it's on one uniform screen, so that when you tap it, you're going to go through. Actually, I'm speaking for UX because we haven't seen it completely yet, but that's what they told me. So this is dynamic for the provider, for the location, and we did it in this order because the options are: if we give them the option to pick any date based on the first criteria without selecting a location, this gets really messy because then you don't know actually where you're booking. And which was a point of contention that we've had, that it was hey, we don't know what's more important, date and time or location. So that's why we're trying to unify these screens so that we can get to the point of being able to be okay, we know you want to see him here, or is date and time more important to you? Because depending on who you are, right, it may be better for you to go to the closest location and be I don't care when it is, or be I work 9 to 5, so I need an evening appointment on Tuesdays. Which is more important to you?
That varies too. If it's your primary care physician, you want somebody in your neighborhood. If you need to see an oncology specialist, you're going to drive anywhere you need to. So that changes based on what you're picking.
Yeah. Good.
So one of the limitations of React Native is you can do a lot in the runtime, in the JS runtime.
Yep.
But often we have to drop down, we have to get into the OS or the specific implementations for iOS or Android. How much of this app did you have to write those connectors or get into those connectors?
We have very little of that code. this has been all in JS. I think there's a handful of things we had to go in, but they've been things with like patching React navigation.
Navigation.
Yeah, navigation is the only time when we've had to actually dig in and go through and be like, hey, we need to go and actually write native code. But I would say the number of native files are less than 5. So I mean like a handful.
So you've been able to handle this entirely almost with just JavaScript.
Just JavaScript.
and React.
Yeah.
Have you hit any resource limitations when you're managing state?
Yeah, so that one is one that has occurred. We discovered we had a record that had 2,400.
424.
Yeah, 24 appointments in their history.
Yeah.
So it went through and it grabbed all of them. So we ran into a point of like, oh, we hit a limit, and then started logging things because it ran out of time.
Yeah.
So we did run into that. We've also run into a few issues with different appointment types because there's so many different types of appointments, which I'll show you the history. But as you go through the history, it's kind of insane to see like how many different types of appointments there are available. And when you do that, like, we ran into issues of how we handle them because we can only book certain types of appointments online. So then that experience is totally different than an appointment that we have to show your history, but not necessarily we can't do anything with it because you may not have a provider because it may be an imaging. So imaging, you don't have a provider, you just have a location. So there's some weirdness that has happened with that. So this is doing another call to go find the actual times to parse those because it already found the dates, but now it's sort the times across. Go through, pick another date. So this screen is kind of unique. Now we need to collect your actual information. But at this point, we've already locked your slot. Like we have essentially almost booked this appointment for you. So you now have 5 minutes to gather this information. And we talked about how when to like lock the actual slot and be like, this is yours. So anytime I click, if I go back anywhere in this currently, it's going to unlock that slot. So I'm going to lose that spot. In theory, you may or may not ever see that appointment again. It also depends on how many slots there are at that time because doctors do overbook. So sometimes you will see this, there may be, you could book this appointment now, we can go back in and there may be another appointment at the exact same time, which is a limitation that we've had with testing because they're like, it doesn't look like it was booked. But then we got to look downstream to figure out where it actually got booked. But that stuff is just anything downstream, like, you know, it's black boxed for development wise. So we assume that if we got back the good response of, hey, we got your application here, we got your response back that says, yes, you've got this appointment. And then at that point, we're like, okay, cool. We don't care what actually happened. And we assume that everything downstream went well. If it doesn't, it does send back a request that we know, hey, it didn't actually work. And that's when a human needs to intervene. If something fails downstream, a human will intervene from the support system to go in and be like, hey, this didn't actually go through, you know, we need to reschedule you. So in our member IDs, group number, group name, member IDs are required, but the group name and group numbers are not, because not every insurance has it. And also insurance cards are really difficult to read on purpose. So Chris can speak way more to how difficult insurance is, because he knows way more about it than I do. But since we can only collect so much information at a time.
Idea, optical insurance card scanner.
So 2 people on our team actually came in second place yesterday at our HIE Ship It Day with that exact idea. So, Pete and Tristan.
Yeah, it was on our like radar of things. Yes, we've talked about that, and I've mentioned to Chris. Chris is like, yeah, skateboard, not scooter or rocket ship.
We're still in MVP.
Yeah, this is MVP mode. So the screen gives us the ability, so you can see the timer still running for 5 minutes. And this basically gives you a last second to go through, confirm that yes, this is the location, this is the time, this is why I'm going, and this is the insurance information. You can also give them anything else to know. Those notes could stay in your record.
So you guys actually made a post that reserved this for 5
Yes.
minutes.
Yes, this is hit APIs that is now said, please hold this slot, and it is the exact same request that a service agent, if you call on the phone, is doing the exact same thing. They've gone through, they've clicked it, and they're like, okay, we have 5 minutes to collect your information. So that is a global setting within Northwell. So it's been a point of contention of how long that timer actually is, because if you let it, if you let it go longer, then now it's locked. You potentially have lots and lots of slots locked. What happened to my simulator? Hang on. Apparently you can only share for so long. Try that again. Okay, so I'm gonna book my appointment.
There's our error messaging.
Yeah, so we hit, occasionally this will happen where, and the timer ran out, that's what happened. So I'm gonna kill this appointment because my timer's officially dead. So I'm gonna back out of it, try to get a new one.
This is the scariest part about demoing in front of a room. I do it like 3 days a week. These are all QA branches, and we don't have a demo branch, so.
Yeah, that's the thing. Yeah. So this is a QA build that somebody pushed something up to. So I know how to get out of this because I'm going to go and book with Kagan because I know she actually works because I tried it earlier. I can tell you. Yeah, but there are times when you get error messages like that where it actually didn't go through. And the thing to do is, hey, we need to call the service request. We are looking into finding a way to integrate that with the service line so that we can send them the information of what you already tried to book so they know, hey, we saw you were trying to do this, it didn't work. Let me help you out with that and get you right back to that same point. That's something that we've explored and we're looking to add because that's a huge feature. If somebody's going through and they've spent like 15 minutes looking for their doctor, they've gone through like the search and finding someone they think they like, and then they get to the point they already entered insurance and everything, and there's like, we don't have anything. But that information is saved, so we could send that over to the service agents. They know.
Are you capturing the error that went wrong in the back end?
Yeah. So yeah, it's very deep in the app server that there is we have a log of why that went wrong.
Yeah.
I have a good idea of why it went wrong. I think the slot actually wasn't captured anymore. I think the time ran out. We've had that problem where the timer may not actually be 5 minutes. So when the unlock message, it may take a few minutes for it to actually unlock on the API side. So like in the scheduling app, we don't have the ability to know when it's actually unlocked. So we could go through and you could try to, it could still be locked for you.
Is that 5 minute, is that like a magic number in the React Native app, or is it a response back from the post?
It's response back from the posts. From you go and you say this slot's mine. They're like, that slot's yours for 5 minutes. You now have 5 minutes to finish and click complete or cancel. And that's the problem is when you hit the cancel problem that it doesn't cancel immediately. And that's something that we cannot fix. It's a limitation of the API system, not us. This account may actually be one of the bad ones too. So I may have to switch accounts if that's the case. But this actually saved all my information, so I already entered it in. So that is saved from previously because it's saved in Redux. So it knows, hey, you tried to book an appointment, guess what? I'm going to save your insurance. And also saving actual insurance in your account is actually something that we're adding. It's on our roadmap to add soon. So there we go. At least it says something to do. So now it has gone, this appointment has now posted back. It says, hey, yes, I want that appointment. And now it's going downstream and trickling through all the other systems because there's other systems that, exist. How many systems does it go through?
So it goes from us into the scheduling system into registration system, back to the scheduling system, downstream to the HIE, and then we ask HIE for the details.
And then it comes back and gives you that. You're a successful appointment. And from here, so from any appointment that is online reschedulable and cancel, or online manageable, I guess is right, you can reschedule it or cancel it right from the appointment. So I'm going to actually reschedule this guy. This account is bad. That's what it is. There's too many appointments for her. We found a limitation of the number of appointments you can have in a single day. And it's a limitation on the scheduling side because it rolls anything on the same day with the same provider at the same location. It thinks it's one encounter. You can have multiple appointments in an encounter. So that is a limitation. Once you have, I don't know what the number actually is, but once you have a few, you start getting those issues. But in reality, as a user, you're never going to hit that, right? And if you do start hitting that, it's only mess up for like one day in like your history, and like you should be able to get through any other way. Well, let me see if I can reschedule. There we go. So that's the one thing. The one that is a little bit slow switching between these screens because it's taking that call again and trying to parse how many appointments you have available. So now, same thing. If now Chris said, "Hey, I have your new slot. You now have it for 5 more minutes. Double check what you want to do. Do you want to keep it? Do you want to dump? Do you want to change it?" You change it, goes through. This is the same exact call. Sends it downstream to all of the systems. It cancels it first and then then books it new, right?
Nope, it's rescheduled.
It actually reschedules. Okay. Yeah, you can also call directly to the line, which is a unique challenge because not all providers have a real phone number. Some providers have to go to different call systems, so we have that dynamic. Based on what provider you are, what location you are, it will either hit their office number or the practice number or the generic scheduling center.
Are you using GraphQL for your querying and then REST for your like mutations, or?
So some of the systems, so everything coming from the scheduling API is REST. Whether it's querying or posting. Anything coming, like bringing in doctor information, is coming through GraphQL.
How do you handle versioning challenges between the API side and the application?
So the API side moves.
Do you have to roll out updates like 3 times a day, every day?
Not really. So the API side, like the black box stuff, moves really slow. Like we're talking like 6-month like turnaround times for things sometimes. Versus our app server, like we can make changes on the fly at any time, right? Because since we own that part of it, that's why we have that, because we can make those changes to whatever happens downstream quickly. So versioning wise, there have not been that many releases to the node server, but the application itself has had, we do like 1,000 builds in, I don't know how long. 9 months.
We built 966 this morning.
Yeah.
So a breaking change to your app server, you would follow that up with an immediate release to your app.
Exactly.
You basically crank those up.
Yeah. So yeah, if we have that. So our release cycle currently is we're doing wave releases. So this is still in private beta. So we're doing like wave release. So we've done 3 wave releases. So we had an initial batch with the app server, it went through. And then there's the next batch, next release that did updates that added more functionality. So we just released little bits of functionality over time. It is officially like all of the booking functionality and the rescheduling was live on Thursday of last week. So we actually booked the first appointment that says this got booked with DFD scheduling, which is our like name, or Dpx scheduling, which is our name for that in the system that, hey, this got booked not from an agent, but from the application itself. So we booked Chris booked our first appointment, which was a kind of a huge.
Yeah, I've worked there for like 2 years, so it was awesome.
Yeah. So
does the app server just act as a middleman between?
It's our middleware.
The client. Does it do a lot of transformations of the?
Lots and lots of transformations. Because the data that comes in, there's a big problem with dirty data from lots of systems coming in and then us having to transform it to being something that we can understand.
Do you see any benefit of possibly the front-end app speaking GraphQL queries natively instead of REST calls in the future?
If we could, yeah, it'd be great, but...
And allowing like a GraphQL server to do the transformations and act as that.
Yeah,
that
it would be cool. I think there are some limitations on why we can't do that. I think the transformations are pretty insane and that's why it's not all GraphQL. Because there are some systems that are SOAP, so we have to translate a request from REST into a SOAP request on the app server and send it out, right? Lots and lots of like weirdness because we don't have control over those APIs, and that's kind of one of our limitations is that black box of stuff that we don't have any control over. They just tell us what we can do, And we're just like, okay, that's it. Like, that's our limitation of the system. And we've been working with those partners to try to figure out better ways to kind of help their product, help us develop a better experience.
Are you guys using Apollo to transcribe?
No.
GraphQL or anything like that? All
Yeah, all just normal resolvers. So they're all handwritten because they're just so different that we do have Apollo, but we don't use it for anything currently. It is one of those things that we wanted to do, but just for what we did, just wasn't going to work at that time. And we are moving pretty quickly. That's also something that our releases are quarterly, so we have 12 weeks of sprinting, and that's it. And we have to get basically big features out in the amount of time. And then it's not the move fast and break things policy. It is move fast and deliver value. Like we would rather have something not be finished than it to be half baked. And because we were trying to make a great experience for everybody. So if you get something half baked, we would rather be like, okay, we have to wait till the next release because now we want it fully baked and ready to go. So next thing we'll go back to our appointment history, which is a challenge in itself. So because there's different kinds of appointments, this is a pretty clean user, and they only have a few actual providers, but some of these have dozens and hundreds of appointments, right? So, and they all show up differently, whether they're an appointment that can be scheduled through their systems, or there's other appointments that aren't scheduled through their native system. So whether it's at the practice level or imaging or walk-in clinics, like those appointments show up in this list, but they don't necessarily have anywhere to go. So like they may show you details of when it was and where it was, and that may be it. And may just say, Go Health into their walk-in clinic system. So Go Health appointments just say, hey, you went here at this time. So like there's unique situations with all of these that, like all of these are actual providers you can book. But when you start seeing the ones that you can't, that's when you start having to filter out different things. So like this is not their entire history. There's probably other appointments in here. So if there's no show appointments, they don't show up. And these are all upcoming actually. So when you go back to the full list of their past appointments, that's when you start seeing we don't show canceled appointments. We don't show no shows. We don't show pending.
We only show the statuses that we thought would be meaningful up front. We're working with building filters. Once we have all the filters, we want to add back in those pieces, but allow you only to see it in that filter view. The example is that 2424 patient. 2415 of those were canceled appointments because it's a test patient, so that would just cloud up your history. So we wanted to show what's meaningful up front and filter out the rest.
Cool.
Do you deal with very complex data? Is there any need for volatile kind of database or storage instead of app servers or something?
Okay. So, like Greg mentioned before, one of our challenges is a lot of it is black box, and especially when you're dealing with healthcare, we're then dealing with protected health information. So there's a lot of rules around what we can use and where and how we interact with it.
Yes, the caching question, PHI is never cached. At least in the app server, we don't cache any of that there.
And
it may be cached locally on your device.
PHI can be very simple too. You know my account and you know the doctor. That's not PHI. If that's a psychiatrist, you can infer that I saw a psychiatrist. So it can be that simple before it becomes actually protected health information.
Yeah, we had that. We had to get use exceptions for things like Google Maps because Google Maps can see, hey, you search for a psychologist. Now we know, hey, you're seeing a psychologist. That's PHI. Which is that. The first time I heard that, I think that just blew my mind that you just, you see those two things you don't think they're connected. So this is the bill pay interface. This, if you click here, it's going to take you to sorry, that's a bad example. This is going to take us back to this will dump us out to a browser, then you can go with single sign-on as well, where you have to log in because we haven't passed the information from the app to the provider, or the app to the website yet. It is on our roadmap. The other kind of important part, so your profile, all of your information, you can set all of the data that you want here. So you can change certain things. You can change most things. You cannot. You cannot change your legal name. You cannot change your date of birth. You cannot change your email once you're verified. But you can add preferred pronouns, preferred names, because we found out that this is important, because once we know who you are, you may be known as something else in the system. And then this is the other locations. What was the reasoning for locations, Chris? Sorry.
So you can search for a location without the context of a provider. You might just want an emergency care, emergency room, or urgent care. Or you might want to see a list of people that can be PCPs, your primary care physician, regardless of whether it's internal medicine or family medicine. So this essentially mirrors what we have on our .edu website now, the location category search, and so we built it here in the app.
Yeah, and the .edu website is the main Northwell Health website. So we just refer to as .edu because it's northwell.edu. So this does mirror that same thing. But this pulled my current location, and it knows those are my closest clinics to me for any clinic, any type of service. But if I went through and picked out another one, it will be able to spin, hey, here's the closest doctors to me. Granted, we're here, so there's nothing super close. Yeah. Any other questions?
What sort of technical regulatory do you have to go through? I'm guessing it's a lot.
Yeah.
In any healthcare work I've done, it's basically like 10 weeks of work, 6 months worth of lawyers to sort of verify that you've done everything right.
So
Like,
we
I would think with this, there has to be
We deal with a lot of that, but our typical process is we design something and then we have to bring it to architectural review board. They'll look at all of that stuff. When we actually, depending on what it is, we might also have to go through penetration testing. So when we did the bill pay piece, that was huge because you have to be PCI compliant. So we have to do a full round of PCI and pen testing, go back, do it again. And so anytime we change certain things, we have to do all of that all over again. But the biggest piece is just that architectural review. They'll go through and poke holes in everything you're considering, and if they don't like it, it's not happening. You have to go back to the drawing board. And so we do like 2 or 3 of those a quarter now. We've been trying to structure it that way instead of just, all right, we built this stuff, we need to make it happen. We just now have tried to draw them into a constant cadence with us. One of the other challenges we're having is we are an agile shop and our company is not an agile shop, so we're undergoing that transformation at the same time. We're very much waterfall, so trying to bring those 2 pieces together has been a challenge.
Yeah, we've had issues where they told us 10 weeks to get something done, and we're like, no, we're going live next week. So,
but yeah, the lawyer question is something I don't want to say I struggle with, but it's a constant source of frustration for somebody like me.
yeah.
charge hourly.
This
Yeah.
just for iOS or
It is Android as well. So
platform specific code you have to yeah.
there's more platform-specific code on Android than there is in iOS, but there's not a ton of it. Like I said, there's probably 5 or 6 files that exist in that like natively. Most of the challenges around that we've developed have been around Android, because React Native in general is not great with Android. Right? There's a lot of things that we've had to work around that we spent lots and lots of time figuring out to try to figure out why it's not working in Android, but it is working in iOS. So right now we are a version behind for React Native, so we are on 5.9. Basically 6.0 did come out. We looked at it and we're just like, we can't do it right now because we're dependent on some packages that either aren't updated or they're not going to be updated. Because right now in the React Native world, I think the average is 75% of the packages are maintained by a single person. So that's one of the biggest problems in the React Native space, is that these packages are written by one person and that's it. And then once, it's kind of if you get hit by a bus, what happens in that package? It just disappears, right? So that's one thing that we've struggled with to try to figure out how to use the minimal amount of packages that we can to get the functionality. And that's why we started removing native base, was because the package, we had things that we needed from them and it wasn't being provided fast enough for us to be able to update. We did do a major version update of 5 or 6 versions. I mean, nothing major, I guess, in React Native because it's still in 0 dot whatever, but we did a 4.7 to 5.9 migrate upgrade, and it was chaotic, to say the least.
How much do you guys rely on QA versus test coverage? How many tests?
We rely on our QA team very heavily. We don't have a lot of automated testing, just because it's just hard. It's time-wise. So we have a QA team that goes through and they just rip it apart. Like they write their test cases and do a really good job of finding our problems before it gets to production. We have, I don't know how, that team's big. I don't know how big TCOE is.
We have a dedicated, so like for our Scrum team, we have a dedicated QA lead, but then she has, I don't know how much all.
I don't know how many people she has that help her.
Was there a compelling reason to use React Native or to use an app on the phone as opposed to just web?
So why we decided to go with an app instead
Yeah,
of just
I mean,
website?
you could do all this in a website.
And we're going to. So one of our things in the next, for the rest of the year, is to achieve feature parity. So everything we've built in the app, we want to build there as well on the website. But one of the reasons we went with app is just, that's just how a lot of people interact with businesses these days, right? Everybody wants to use an app. You have it right on your phone. It's
Well,
a little bit easier.
there's an inherent sort of barrier there to get people to download the app.
Correct.
Right? Everybody's got a browser, but not everybody uses the app.
So I guess the idea on the app side is that's kind of customer success, customer retention, and on the web, it's new patient acquisition. So new patients are going to hit us first on the web, but then people that are already in our ecosystem, they're going to want to use the app for all that stuff. So essentially, we don't win one without the other. We need to do both.
It doesn't appear as though you're using a lot of native features like camera roll or location services or anything.
Location, there's a lot of location services
is there?
actually. Yeah, there's a lot of location services, and that was something that we struggled with mostly, because they just don't work the same in Android versus iOS, right? So things don't behave the exact same way. When we did search for locations, so you can basically just be like current location, and it'll search for your current location. But I just wanted to pick a provider, a location that I knew had locations nearby to give me better results. We also did rescheduling and canceling before we did booking because there's logistics behind it. Rescheduling and canceling is harder to do than booking. So that's why we built that experience before we built actually booking new. So that experience went out before the booking new went out.
So in order to cancel and reschedule, you have to show all of your appointment history. So we had to figure out where to get all of that from first before we could actually offer those options.
Yeah, and booking new wasn't as much of because booking a new appointment is more on the website side because they're going to be, the customer's going to go in, a new patient's going to be searching for, I need a cardiologist. They're going to go to northwell.edu, find a cardiologist, and book that way. They're going to find their information. And we didn't have that built yet.
The other challenge too is we get 2 million hits a month on our website, and so it didn't give us the opportunity to scale small. In the app right now, we're just in a beta version, so it's private invite only, so we have the opportunity to let X number of people touch the app, mess with it, study it, do some UX research, fix it. The day we put it up on .edu, we exposed it to 2 million hits a month to the general public, so that was one of the reasons why we kept it in that ecosystem as well.
So then you have to scale that app server as well.
Yeah. That's one of the things we're looking at for our next release when we get to .edu is what do we then
That's kind of your
expose.
single point of failure, not that you don't know that.
Cool. I think Brian said that's time. So thank you, everybody.
Thanks, guys.